It can attach to skin and feed for days without ever being felt. No pain, no itch, no warning at all, while injecting a steady trickle of saliva engineered to keep the body from noticing anything is happening. By the time most people discover it, it's already swollen, gorged, sometimes hidden in places never thought to check, behind a knee, along the scalp, tucked into skin folds, and in a documented portion of cases, it has already delivered something far more lasting than a bite, a bacterial infection capable of spreading through joints, nerves, and even the heart. This is the black-legged tick, often called the deer tick, found extensively across the northeastern United States, the upper Midwest, and increasingly in parts of the South, typically in wooded areas, tall grass, and leaf litter, the exact kind of terrain bordering hiking trails, backyards, and suburban parks throughout much of the country. Unlike most dangerous insects, this one doesn't need to be sought out in some remote location. It's often waiting in the grass at the edge of an ordinary lawn. What makes the black-legged tick dangerous has very little to do with the bite mechanism itself and almost everything to do with what it can be carrying. When a tick attaches, it uses specialized mouthparts to cut into skin and insert a feeding tube, then begins slowly drawing blood over a period that can last anywhere from several hours to several days if left undisturbed. To accomplish this without being noticed and brushed away, tick saliva contains a sophisticated mixture of compounds. Anesthetic-like substances that numb the bite site, anticoagulants that keep blood flowing freely, and anti-inflammatory compounds that suppress the body's normal itching and swelling response. This combination is precisely why so many tick bites go completely unnoticed until the tick is found still attached, sometimes a full day or more into feeding. The real danger emerges if that particular tick happens to be infected with Borrelia burgdorferi, a corkscrew-shaped bacterium responsible for Lyme disease, the most commonly reported tick-borne illness in the United States. This bacterium typically lives in the tick's gut, and transmission to a human host generally requires sustained feeding, often at least 24 to 36 hours of attachment, since the bacteria need time to migrate from the tick's gut into its saliva before infection can occur. This is precisely why removing a tick promptly, before extended feeding occurs, significantly reduces the risk of infection, and it's also why the tick's numbing saliva is so consequential. By preventing detection, it buys the bacteria the exact window of time they need to complete that internal journey and reach the bloodstream of whoever is unknowingly hosting the meal. Evolutionarily, the bacterium isn't something the tick benefits from carrying at all. It's simply along for the ride, a separate organism that has adapted to use the tick purely as a transport vehicle between hosts, the same way pathogens exploit mosquitoes, except operating on a dramatically slower, more patient timeline that depends entirely on a tick going completely undetected for extended periods. In most cases, the bite itself produces no sensation whatsoever, no sting, no immediate itch, nothing to alert a person that anything has happened. Often, the first sign isn't the bite, but simply discovering an attached, slowly swelling tick during a routine check after time spent outdoors, frequently in a location easy to overlook, like the back of the scalp or behind an ear. If infection does occur, the most recognizable early sign typically appears within 3 to 30 days, a distinctive expanding rash at the bite site. Often described as resembling a bullseye, a red center surrounded by a paler ring, then a red outer edge, though the rash doesn't always take this classic form and can sometimes appear as a more uniform red or pink patch instead. Alongside or shortly after the rash, many people develop symptoms resembling a mild flu, fatigue, headache, mild fever, chills, and muscle or joint aches, often dismissed initially as an ordinary seasonal illness with no apparent connection to a tick. If the infection isn't identified and treated during this early stage, it can spread through the bloodstream over the following weeks, sometimes reaching joints, the nervous system, or, less commonly, the heart. In documented cases involving the joints, this often manifests as sudden, significant swelling and pain in one or more large joints, frequently the knee, sometimes severe enough to limit walking entirely. Neurological involvement, while less common, can include facial palsy, a sudden weakness, or drooping on one side of the face caused by inflammation affecting a facial nerve, along with headaches, neck stiffness, and in rare documented cases, more widespread nerve pain or tingling sensations spreading through the limbs. Cardiac involvement, though rare, can produce an irregular heartbeat as inflammation reaches the heart's electrical conduction system, occasionally requiring temporary medical intervention to manage the heart's rhythm until the infection clears. Picture someone returning from a weekend hike through wooded trails, showering that evening and noticing what looks like a small, dark freckle behind one knee that wasn't there before, easy to dismiss as nothing in the moment. Days later, a slowly expanding red patch develops in that same spot, accompanied by an unusual wave of fatigue and joint aches that feel disproportionate to a normal day's activity, eventually prompting a doctor's visit where the tick bite and the symptoms finally get connected. The good news is that Lyme disease, when identified early, responds well to a standard course of oral antibiotics, typically resolving the infection completely within a few weeks, with no lasting effects for the vast majority of people treated promptly. Even in cases where the infection has progressed further, involving joints or the nervous system, antibiotics remain effective, sometimes requiring a longer course or, in more serious cases, intravenous treatment. Anyone who develops an expanding rash, unexplained joint swelling, or facial weakness following time spent in tick habitat, particularly if a bite is recalled or discovered, should seek medical evaluation rather than waiting to see if symptoms resolve on their own. There's one more detail about this tick that explains exactly why so many people never even realized they were exposed in the first place. Here's the fact that surprises most people. The black-legged tick that transmits Lyme disease is often at its smallest, and therefore most dangerous in terms of going unnoticed during its nymph stage, an immature form roughly the size of a poppy seed, far smaller than the more recognizable adult tick most people picture. Nymphs are responsible for a substantial share of human Lyme disease transmissions, specifically because they're so easy to miss during a routine skin check, small enough to hide in hair, in sock lines, or in skin folds without producing any noticeable sensation at all, often remaining attached for the extended feeding period required to transmit infection simply because no one ever spotted them to begin with. The black-legged tick doesn't need speed, aggression, or any dramatic method of attack to remain one of the most medically significant arthropods in the country. It only needs patience, an excellent numbing agent, and the willingness to wait, quietly attached, for exactly as long as it takes. And somewhere in that same patch of tall grass or fallen leaves, another creature with its own slow, easily overlooked method of harm may already be waiting for the chance to go unnoticed too.